Alo, it's Earle, and this is the time I get to spend with you guys and go over plastic surgery topics and answer all of your yearning, burning plastic surgery questions. We're here at Pure Plastic Surgery today, you know you're coming to a great source because I am an Ivy League trained, Ivy League educated, Duke trained, double board certified plastic surgeon with 12 years of experience under my belt on top of that. All right, so we're going to talk about anything that has to do with plastic surgery. Before that, cheers, it's tea time. It's tea time here at Pure Plastic Surgery. So I'm having my Earle Grey tea.
I was going to ask that. What's your favorite tea?
That's right, Earle Grey. All right, so what are we going to talk about here today? So today we got something really special. I've been waiting for this for months, and it finally came out, and we did our first 2 cases last Friday. Super exciting. And not only that, we are the first and only people that have this here in the Southeast coast area. And so, what are we talking about here today? We are talking about Alo Clay. Alo Clay. You can see that right here. Okay.
Yep.
So this is the Alo Clay. And what is the Alo Clay? Well, you know, one of the most questions that we've gotten throughout the years is, hey doc, can I donate my fat? Can I use somebody else's fat? Some variation of that. And for the longest time, we're like, no, it's not possible. The only fat that we can use is your own fat. And guess what? Well, now we can. Finally, we can use fat from another person for you. Okay? And that is exactly what Alo Clay is. So Alo Clay is fat, and it's what I like to call off-the-shelf fat. I mean, quite literally, this is it. I mean, it's inside the box, and it's sterile, so I can't open it up for you. But it's right here. It's right here. It doesn't have to be in the freezer or in the fridge or anywhere else. It's basically, you stack it up on the shelf, you grab some fat, and boom, you put it in. Right? Very easy. Off the shelf, can be a room temperature, and what it is, it's basically fat. It's this fat structural filler. Okay. And it can be used for larger areas, because your typical fillers like the hyaluronic acids, like the Juvederms and Renew and all that stuff, they typically come in little tiny 1 cc syringes. And that's why they're used mostly for the face. You don't need a lot of volume in the face. But the Alo Clay comes in 12.5 cc syringes and up to 25 cc's at in one box. So this box here has 25 cc, so it has 2 12.5 cc syringes, and then of course you can use multiple boxes for someone. You can put in 100 cc's into either side. So now we can use it for the body, and it works very, very nicely for hip dips. So all you thin patients out there who's got a BMI of 18, and you wanted your hip dips filled in, everyone kept telling you, hey, you're not a candidate because there's no fat. We can't get any fat from you. Well, guess what? Now you have an option. We can use Alo Clay, off-the-shelf fat, to fill in your hip dips. Okay? Where does it come from? It comes from organ donors. So the same people that donate organs for other things that have passed away. So deceased organ donors, I should say. When people, like you have on your license sometimes, you say if you pass away, you donated organs. Well, it's very similar to that. And so the fat is harvested, and then it goes through a treatment process. And this is the revolutionary part of it. It goes through a treatment process where all the nuclear and genetic material gets removed. Okay? And therefore, you can now finally transfer it from one person to another without having any sort of rejection or reaction. And that's the crazy thing that they were able to do. And then, of course, in that process of removing the genetic material, they, of course, also sterilize the fat. So it's completely sterile. There are going to be no infections here, no things that people might worry about, whatever it is, whether it's a bacteria, virus, hepatitis, blah, blah, blah. All of that has been completely removed and cleaned out. So it's 100% sterile, and it's going to be non-reactive. Okay? So that's great. So that means we have this beautiful, basically fat cells with what's called the extracellular matrix. So the fat cells and the ECM all together, providing that beautiful structure to fill in large areas. And so now we can fill in your hip dips. For those that have had BBLs already, a lot of times you have a BBL and maybe a spot here or a spot there where you're like, oh man, I really wish I could just add just a little bit more to that spot. But then you're thinking, oh God, I don't want to go through a BBL again. That recovery was tough, right? And so now we have a great option for you because this is done in the clinic setting under local anesthesia with no downtime. What? Okay, so in the clinic, right? It's done in the clinic under local and no downtime. All right? So no need to go through a whole pre-op process. No need to go, once again, to get labs and the medical clearance and an EKG and all that other stuff. No need to go through a difficult recovering from all the lipo areas where you have to do your compression and your massage and all that stuff. Basically, you come in, we do some local anesthetic, we numb up the area, we place the AlloClae, we fill out the spots that need to be filled out, and boom, you're up and you can go home. You can even drive yourself home if you wanted to, okay? So yes, a great option for all of that. So filling in hip dips, especially hip dips in smaller framed or lower BMI patients. Filling out specific areas after your BBL, like smaller areas that may require maybe 50 cc's up to 100 cc's, okay, to fill out those spots. Great option for that as well. Okay, what it's not though, it's not going to be like for doing like an entire BBL, right? Like I'm not going to be putting 1,000 cc's of AlloClae like I normally do for your typical BBL, where I put in 1,000 cc's of your own fat to give you more projection, fill out the hips, etc., right? So that's the one thing that it's not going to be, okay? But for these other indications that I just talked about, it is a beautiful solution. So I'm happy to answer any questions about AlloClae or anything related to plastic surgery.
Let's start with the AlloClae one and let's say how safe it is.
Great question. So how safe is it? The good news is that it's extremely safe. All right, you can put it in the same category as safety as your other fillers, right? Like your Sculptra, your Juvederms, etc. All the other fillers that you already know about, right? So it's in that same category. It's basically a filler, but it's a higher volume filler that works well for the lower body. So once again, all the genetic material has been removed. Therefore, it is non-reactive. It is, of course, sterile, just as sterile as your hyaluronic acids or anything else that we do in the clinic or in the operating room setting. So the incidence of complications such as infection is extremely low. It's all placed through a little tiny cannula. So like a little tiny, cannula. The cannula is what the device that we use to deploy the AlloClae. So it's all placed through a little tiny cannula, tiny, basically stab incisions, almost no scarring.
So we know that after surgery we need to walk for 10 minutes every hour to prevent blood clots.
That's right.
Do we also follow this while we sleep? Meaning we have to wake up every hour to take a walk?
Right. So if if you had no other kind of sort of protection, then the answer would be yes, you would still have to do that. However, right, that's extremely, difficult. And so what do we do here at Pure Plastic Surgery? So what we do here is that we give you a device for your legs, which is now called the Vena Pro. It used to be called the Circulate, now it's called the Vena Pro. But what it is a sequential compression device that's being placed in the leg around the calf, and it keeps the circulation moving, all right? All of our patients that are getting like a bigger surgery, such as a mommy makeover, a tummy tuck, Lipo 360 or BBL, are going to receive this device from us, all right? And so what you're going to do is that you're going to use that device for the first 2 weeks, and you're going to use it at night while you're sleeping, or anytime you're sleeping, anytime you're not being very active. And then for our out-of-town patients, you're going to use it on the plane, right, on the flight as you head home. And so when you have this device, that allows you to be able to rest at night, You don't have to get up every hour as long as you have the device on and working.
Thank you for your answer. Love all the information you shared.
There you go.
Okay, there are plenty questions about pricing for the AlloClae, pricing of the BBL, so how they can know it.
Right, so pricing is a common question. So pricing for the AlloClae, excuse me, that's going to depend on how much we need, right? It's going to depend on the volume and everything else. So if you want to have, a quote basically tailored, specific for you, the best thing to do is to get an evaluation, right? And so the easiest way to get an evaluation is to go to our website. So go to www.pureplasticsurgery.com, and there you're gonna find a button. One of them says like start your journey here or virtual consultation, and that's gonna allow you to then put in your information, and then you're gonna get a call from our patient care coordinators, which will then walk you through the process and give you your personalized quote.
Okay, is it only used for fillers and not for a BBL increase?
Yeah, so the AlloClae, again, can it be used to say maybe give you a little bit more projection? Yes, it can be used for that, okay? But what I'm trying to say is that don't think of it like it's going to be a complete substitute for your typical BBL, right? Because we are not going to be putting in as large a volume as we can with your typical BBL, right? For me, say the average amount of fat that I place per side with the BBL is somewhere between 1,000 to 1,200 cc's of fat. Okay, and so we're not going to be able to place 1,000 to 1,200 cc's of the AlloClae. All right, but what you can think about is say maybe you just want just a little bit more projection, maybe like just 100 cc's more. Then yes, we can do that. Or say you have like just a very specific area where maybe you lost a little bit more fat there than everywhere else, and you just want to boost it up a bit. Then yes, the AlloClae is going to work for that. Say you're very, very thin and you have hip dips. Well, for those thin patients, you don't need a ton of volume just to fill out the hip dips. So the AlloClae is going to work for that as well.
Okay. Here we have another AlloClae question. And
yes, please keep them coming.
Yeah, very interesting in the topic.
This is exciting new stuff. You're not going to see it almost anywhere else. There's maybe a handful of practices that have this now in the U.S. And we are one of them, and we're the only ones here in Florida.
Is it just for the hip dips, or can be used for breast or even face?
Great question. I wouldn't use it for face. It's too big for face, right? There's a whole bunch of other stuff for face already. The face is actually kind of like saturated with all the different options there are for fillers. But there was never any great fillers for body, and that's where this comes in. Can it be used for breast? Yes, it can. And so one of the exciting things about this is that potentially it's going to be used for breast, especially for those that are getting breast reconstruction, right? Those that have had, like skin sparing or nipple sparing mastectomies, and then they have a reconstruction with an implant, and they need some areas where you need to give it a little bit more volume, a little bit more fill to smooth out the contours. And so that's something that's going to be very exciting as well. So yes, it can potentially use in the breast, and then, like I said, probably in the hips and the buttock as well.
Can it be used in lips?
Again, not your indication for this is bigger, right? You got to think of it as like bigger volume. Okay, you're never going to put 12.5 cc's or anything in your lips. Please don't. That will blow up your lip. It's going to look ridiculous, right? Remember, the syringes that we put in lips are typically about 1 cc, right? We're talking about here much bigger volume. We're talking about 25, 50, 100 cc's, okay?
So we're talking like one of those is like 100 of the lip fillers?
Well, one syringe is like 12 and a half of the lip fillers, okay? Each syringe has 12 and a half cc's. This packet here has 2 of those syringes, so we have 25 cc's total, which would be like 25 of the lip fillers, right?
Yes. Do you recommend doing lipo if I have varicose veins?
Okay, so it depends on the degree of the varicose veins. If you have like a mild amount of varicose veins, or some spider veins, things like that, it's typically not a big deal. And yes, it is okay to do lipo 360 or lipo fat transfer BBL. Now, if you have, quite a severe amount of varicose veins, where you can really see large, very large distended veins in the lower extremities, then I would not recommend that. So the best thing to do is get an evaluation.
Okay. I'm close to my surgery, but I'm afraid of the drains part.
Yes. Why?
That was a comment, but maybe I think for timing could be.
Right. No. So a lot of no. I'm asking because a lot of patients are afraid of drains, right? And so as a surgeon, of course, I'm super used to them. I put them in every single day. And so sometimes I wonder what it is exactly about the drains that people makes people to be afraid of them, right? I think it's just the idea, the concept of that something's kind of hanging out of your body, right? And so it's just more of a concept than anything else. But a drain is not dangerous. Of course, they're there for a reason, and the reason for the drain is to be able to remove fluid as your body heals, so that the tissues that have been separated, whether it's by liposuction or because you dissected them and you had to separate them out, such as in a tummy tuck, those tissues have to heal and seal back down again, right? And they can't physically do that if there's fluid trapped in between, right? They can't get together if there's fluid in there. So what the drain does, say the pen is the drain removes the fluid, allows the tissues to stick together so that they can heal together, okay? And so that's why drains are necessary, especially for your regular tummy tuck, okay? And I do use them also, I like to use them for your Lipo 360 and BBL, because it also is a conduit for the fluid to come out when you're getting your massage. So as you're getting your massage, you're pushing the fluid down. That fluid needs to come out somewhere, and so they can push it down into the drain and then comes out the drain, all right? And so I don't think drains are evil. I know people don't like them, but I think drains are actually very, very helpful. I do highly recommend them. Even though it's not absolutely mandatory for your Lipo 360 and BBL, I highly recommend them. If you tell me absolutely not for those procedures, then okay, we'll work around it. But it is mandatory for me when I do the tummy tuck. Now, if you're someone that wants to do a tummy tuck and you are totally against drains, then guess what? We got Dr. Wigger here, who is an expert in what's called the drainless tummy tuck. So it is quite possible to be able to do a tummy tuck without drains if you know the proper technique, and Dr. Wigger does. So if you're interested in that, please send us your information, and we'll be doing, and Dr. Wigger will do an evaluation for your drainless tummy tuck.
And also, he has a free consultation day.
Oh, that's right. When is the free consultation day?
March 14th.
March 14th. All right, everybody. Hey, in person or virtual or both?
Both.
Okay. So you don't even have to be in town. All right. So March 14th, you want a free consult with Dr. Wigger? You want to look into that drainless tummy tuck? Hey, that's your day. Okay. No charge. You can come into Pure or you can do it virtually.
Yes. The info is all over our social media, just to let them know.
There you go. Look it up.
Shanti, I got a tummy tuck and Lipo 360, but he, not you, other doctor.
Other he, yeah.
Yes, other he. But he didn't remove fat from upper stomach for blow, and now my upper belly sticks out more.
Yeah. So that happens sometimes. And so let's break that down a little bit. First of all, I don't like to combine Lipo 360 and tummy tuck at the same time. Okay, there's many reasons for that. We've gone over it in the past, but one of the main there's one reason is that you really can't do it here in South Florida if you're following the rules. Of course, not everyone follows the rules, and that's up to you whether you want to go to a surgeon who doesn't follow the rules. But the rules are that you can't remove more than 1,000 cc's via liposuction when you're doing a tummy tuck here in Florida. And I'm talking about a written rule, right? So that's number one, right? And 1,000 cc's is typically not enough fat to remove for a full Lipo 360 for it to make a difference. And then number two, it does increase your risk. When you combine a complete Lipo 360 with a tummy tuck, the increased risk of infection, of bleeding, of needing blood transfusions, and of blood clots all go up significantly higher. So it is a riskier operation. So I do like to separate them out, and I always recommend doing the tummy tuck first. When I do a tummy tuck, I also don't lipo this central area, right? Because that's the area that we are dissecting and lifting up so that we can then stretch down, cut off the excess skin, and put everything together again, all right? And so you're already doing a whole lot of surgical trauma to the area, if you will, and then if on top of that you do liposuction, it can lead to increased risk of what we call skin necrosis, skin dying, open wounds, bad stuff, okay? So yes, I don't lipo that area at the time of the tummy tuck, but I do recommend that it's coming back at the 3-month mark for doing your Lipo 360 plus minus fat transfer, so Lipo 360 or BBL. And that's the way that I recommend doing it. That's the way you're gonna have the absolute best results. You're gonna get the most bang for your buck in terms of results. You're gonna have easier recovery times, and you're gonna have lower risk and lower complication rates as well.
There's people like joining right now and they want to know prices. Do you virtual consultations? How can I book? How can I get a consultation? Doug, yeah, there were many about the same.
About that, all that? Okay.
Yes.
So
many to ignore them.
Okay. So our recommendation is always to start off with our website. We have a beautiful website. I don't know if you guys have seen it, but it's almost like brand spanking new. We launched it mid last year. So brand spanking new website. It looks absolutely beautiful. I really highly recommend you check our gallery, see our befores and afters. Our gallery is like none other gallery that you've ever seen. So definitely go and check that out. But more importantly, go to our website, www.pureplasticsurgery.com, and there you're going to see a little button where it says start your journey. That's one of the easiest places to start. You hit that, it's going to ask you for some initial information like a name, cell phone, email, okay? And from there you can even go further. If you go to an area where it says a virtual consultation, you can go and actually fill out a more extensive questionnaire and send in your photos for an evaluation. What happens after that is you're going to get a phone call from one of our super dedicated and super informed patient care coordinators, okay? And they're going to go over all your goals, your expectations, a whole bunch of information with you. And after that, they're going to be able to provide you, okay, with a personalized quote, okay? And that's how you're going to be able to get pricing and potentially a date, booking your date, and everything else. Not only that, I mean, they'll be able to help you out with just about anything you can imagine, right? Do you need financing? They'll help you out with that. Do you need a place to stay? They'll help you out with that. Do you need massages? They'll help you out with that. You need transport? They'll help you out with that. I mean, pretty much anything you can think of, they're going to help you out with that.
Concierge pharmacy.
Oh, the pharmacy, of course. Well, that's where that's if you book, right? So all of our patients that are having surgery, we provide your medications for you right here in the clinic, so you don't have to run around town trying to find your meds.
More questions?
Let's do it. Yes.
Yes. Can we have a few more minutes? And this one says, can the Alo Clay, be used after a BBL to fix any dents?
Exactly. Yes. And that is a great solution that we never had before, right? So say this happened to me. This happens. Someone that has a BBL and they're like, "Hey, doc, there's this. Everything looks great. I love the shape, but there's this one area right here that's really bothering me. This little dent here. I don't know what happened. Maybe the fat, didn't survive that well in that area. What can we do?" And before now, I would say like, "Hey, we're gonna have to like lipo, get some fat from somewhere, and then transfer it to that area." And then people are like, "Oh, do I really have to go through all that again?" Right? I have to go labs. I have to get my medical clearance, my EKG. Oh my Lord, there's so much work. Well, guess what? No more. All right. So if you have a little, you have a dent, specific spot that's bothering you, guess what? Now, even for out-of-town patients, you can come in, we do the procedure, you can leave, that same night or the next day. No more having to stay here for 5 days. No more having to get all the labs and all the stuff and everything else. No more having to go through recovery and massages and fajas and this and that, okay, just to fix a little dent. So that's what we're so excited about. So, here you go. Only place to get it, right here, Pure Plastic Surgery. Nowhere else on the East Coast.
Okay, Doug, at Pure, can we pick our surgeon? Can you be requested as a doctor?
Yeah, of course. Yeah, no, we highly encourage that. So even actually, even if you when you go to our questionnaire, if you go to the virtual consultation, I think one of the questions there is going to be like surgeon of preference, and so of course it's going to be myself, Dr. Vidal, Dr. Woodruff, and you can put that there.
Concerns performing a BBL on a patient with a splenic vein occlusion with collateral veins. I read it right?
I think so. Yeah, I agree. That is concerning. Most likely that patient's not going to be a candidate for what we, for the setting that we're in, which is office-based surgery setting. There's a lot of things that go into it, like why is the vein included? Is there a hypercoagulable state, right? Have you had other blood clots, types of blood clots in the past? Any problems in the legs, the lungs, et cetera, et cetera. So yeah, definitely merits further investigation, and most likely, probably not a candidate for this type of setting.
Okay, this is a great solution instead of doing a round 2 BBL for the Alo Clay.
Yes. As long as you're not like round 2. I want to double in size, right? Again, remember, okay, it is great filling up dents. It is great for maybe giving you a little bit more hips. It is great, because the hips is an area that tends to lose a little bit more fat, right? Everybody knows that. It's one of the areas where, say, if the rest of the buttock loses your average, which is about 30%, maybe in the hips you lost 40%, right? Maybe you lost a little bit more there. And so you just want to get that little bit back. And so the AlloClae is going to be a great solution for that.
And look at these questions about that. Does any percentage of that fat die like a regular BBL?
Right, so the good news is that this fat here, it's already, it has only the fat cell and what's called the extracellular matrix structure around it, okay? And so it doesn't have like anything else. Like sometimes when we remove your fat from the liposuction, there's also like maybe some tumescent fluid in there and some other stuff, which is why we lose a lot of that volume. But this is like pretty much straight up fat, nothing else in it. And so it actually survives a whole lot better. We see, that you may lose maybe like 10%, but that's about it. I mean, anywhere from like 80 to 90% of it is gonna survive.
Really? How is the recovery? I live in Dubai and so many BBLs here can be dangerous. It's another message, sorry, in this second part. Yeah. So she wants to know if you get international patients.
Yes.
And how's the recovery to fly back to Dubai?
Great. Thank you. Well, first of all, thank you so much for watching all the way from Dubai. And to answer your first question real quick, do we get international patients? Yes, we do all the time. In fact, most of our patients are from out of town. Most of our patients are from other states, other countries. We get patients all the time from places like Canada and Great Britain and Europe. We've had patients come as far as Australia.
Ghana
as well, right? So definitely would love to have you from Dubai. And why do they come here? For exactly the reason that you mentioned it. A BBL, if it's not done correctly, can be dangerous and deadly, okay? So, but a BBL can be very, very safe if you go to the right person using the right technique in the right place, okay? So I use an ultrasound imaging to make sure that I'm placing the fat in that safe space, okay? I do this for 100% of my cases, and I've been doing this for many years now, since 2019. I'm probably one of the surgeons in the entire world that has the most experience with this, and I've done over 2,000 ultrasound-guided BBLs. 2,000, okay? And I've never had a problem with fat embolism or death. So, book that flight. Oh, recovery, I'm sorry.
To fly back.
I was like, no, just come here. Okay, recovery. You are gonna have to be here for a little while, okay? First of all, you're gonna have to be here a few days before because we're gonna have to get some labs and EKGs and medical clearances here in the States, okay? And so we have to make sure that you are a good candidate for surgery and that it's safe for you to do surgery, okay? And then, of course, you're gonna have your surgery, and then you gotta be here a few days before you fly, take a long flight back home to make sure that you're safe to go home. So you're probably gonna have to end up being here at least 2 weeks, at least 2 weeks. All right, but this is, and now everybody else is gonna get confused. I'm talking here about international patients that are coming from very, very far away, okay? I'm not talking about the people coming from other states. For people coming from other states, you're usually here for 1 week, okay? Just wanna clear that up, because all of a sudden everyone's gonna be like, whoa, 2 weeks, what's happening? No. I'm saying you're coming from very far away, from Dubai. We've had patients come from Australia and Africa as well. So for those specific patients, then yes, it's going to be a longer time here. But yeah, no, if you're coming from the US or Canada, Mexico, even from California, Washington State, etc., it's 1 week. Okay, that's it. All right, well, I was having fun here today. And not only that, I think there's been a lot of excitement about AlloClae. I think you guys are as excited as I am about this.
Where are we located? I forgot.
Located.
Yes.
What do you mean?
Well, no, I know.
Plastic surgery. Come on, guys. We're here in Miami, Florida. The one and only pure plastic surgery, Miami, Florida. All right. AlloClae. It's a hot new thing. Nobody has it. Well, some people do, but very little people do. Nobody has it here in the Southeast except for us. Okay. So make sure you take advantage of that. All right. I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. I'll see you then. Take care. Ciao.
Oh, yeah. Boom.